the British Thoracic Society. My name's Sarah Gary and I'm the Chief Executive of the Property Care Association. And for those of you who don't know the PCA, we are the leading representative organisation for the UK's building protection industry. Our skilled and audited membership operate across domestic, commercial and civil sectors in the structural repair, structural waterproofing, wood preservation, damp protection, ventilation, flood remediation and invasive weed control industries. And we're delighted that today's webinar is being held jointly with the British Thoracic Society. The British Thoracic Society is a professional body of 4,500 respiratory specialists from around the UK. BTS works to raise awareness of the impact of lung disease, champion the respiratory workforce, deliver education and continued professional development to the respiratory team, and develop clinical guidance to improve standards of care. Before we head into this afternoon's session, just a few basic points of housekeeping. Your microphones have all been muted as there are lots of you on the line today. However, if you would like to ask a question, please post this in the chat. We will be taking questions at the end, so please add your questions as we go along and we'll take questions for both speakers in the last 10 minutes or so. Depending on the question you ask, we might not be able to give you specific advice. So please keep your questions general and related to today's webinar. And if you've got any technical problems as we go through today's webinar, please post these in the chat and my colleague Harry will be able to support you. So we are going to start with my colleague James presenting this morning. James Berry is our Deputy Chief Executive here at the PCA, and he became Technical Manager in 2016 and then became Head of the Technical Department before moving to become Deputy CEO last year. He's a graduate of the University of Plymouth, where he achieved a BSc Honours in Applied Geology, but some of his earliest work experience was in the sector of building preservation. James is highly passionate about residential ventilation and leads our residential ventilation group here at the PCA. And this afternoon, James will focus on the UK regulations that exist and what they mean for social and private tenants. And he'll also focus on what you should do if damp or mould is present in your home, when to raise concerns and who to contact for further advice. So without further ado, James, over to you.
No, fine. Hello, everyone. Good afternoon, which feels a bit weird because we normally do this in the morning, but there we are. Having looked, there's still a lot of familiar names, though. So a lot of you will obviously be expecting to hear from somebody else at the moment, but we've slightly reversed it. So I'm going to go first and then you'll have LJ doing a bit on damp and mould. But we're going to start with not the consequences of damp and mould, but what we're doing to address it. And there'll be a bias on rental properties. So we'll get straight into it. And I'm going to start with a little bit of context. So this is from a document that we're going to reference a couple of times today, and one I've spoken of before. And this was from the government guidance, understanding and addressing the health risks of damp and mould in the home. And it says that it's estimated the number of homes in England with damp and mould range somewhere from 4 to 27% of homes. So we're not talking small fry, we're talking big numbers. And, you know, to put that into numbers, we're talking from 962,000 up to 6.5 million. Now, I personally think that's a little on the conservative side. The NHS say that they think that 1 in 3 homes is affected by damp and mould. I don't know how they've derived that figure, but from my own personal experience, whenever I do training courses to housing associations, etc., in my experience, that number is always closer to, well, getting close to 50%. So we're talking a huge proportion of a housing stock that are experiencing damp and mould. Now, we will hear about the health implications, but there's the economic implications as well. Poor quality homes cost the UK economy £19 billion a year. Now, that's from a BRE report, and that's not exclusively damp and mould, but that makes up one of the major contributors. So it is right, there is not only a moral argument for doing it, but for rectifying poor quality homes, but there's an economical one too. So what is being done about it? Well, I'm going to start with a piece of existing legislation. So this came into force back in 2018, a very different world, about 5 prime ministers ago and a global pandemic ago. But the Homes Fitness for Human Habitation Act was brought in to try and improve quality of let properties. And in there it says, where a landlord is made aware of any hazard which makes a home unfit for human habitation, then they must rectify that within a reasonable timescale. However, currently there are no timescales stipulated in law, so it's quite subjective. And if it would be essentially up to a judge to decide what would be reasonable. Now, the problem with that, of course, is that you're almost getting to the worst case scenario before you get an outcome. And of course, there's a huge backlog in our judicial system as well. It takes years for cases to be heard. But there's not much for a landlord to work with there. There is no framework that sort of says it will take, you should get things rectified in this timescale or whatever. And it is this gap, this lack of time frame framework that AWAB's law is aiming to plug. So I'm going to delve into a bit more detail on AWAB's law, but before I do, I think it is prudent just to sort of run through what defects would make a home unfit for habitation. So they include things such as damp, internal arrangement, structural stabilities, fairly self-explanatory, ventilation, means of preparing food, a water supply, natural lighting, or you should be free of hazards under the HHSRS system. Now, I know LJ, when she gets to her presentation, we'll be going into a bit more detail on this, but for those that aren't familiar with that, it's a system that's been kicking around for around 20 years, but there are 29 prescribed hazards as part of that, from asbestos to a lot of repetition that's there. So just to give you a bit of an insight as to what would make a home unfit for habitation. So back to new legislation. So the Social Housing Regulation Act 2023. So this was introduced as a response to the Grenfell tragedy and the events up in Rochdale, which again I know will be touched on in more detail later. But that was obviously the death of young Awab Ishak in his Rochdale home. Now, this act introduces a number of things, but primarily it allows the regulator to take action against social landlords before people are put at risk. So currently, the regulator must have reasonable grounds to suspect that a social landlord's breach of the consumer standards has caused or could cause serious detriment to the tenant before it can use its powers to intervene. The Act essentially removes the serious detriment test, so they can intervene at a much earlier stage. The other thing that this Act does is it will, if a landlord investigates a defect, they will then need to provide a written summary of what their findings are as well. Anyway, I told you this was going to be about AWAB's law and timescales. So AWAB's law was introduced in July 23 as part of this act. AWAB's law is the name that's given to Section 42 of the Social Housing Regulation Act. And that's the bit that's all about timescales. Essentially, what this will do is it will mean that tenancy agreements will have a clause inserted in them that if a social housing landlord fails to meet these prescribed timescales, then ultimately they can be action will be taken against them for breach of contract. So, what are those timescales? So I'm going to have a bit of a caveat here, actually, because the consultation on AWAB's law closed last March. And it's been a bit of radio silence since then, truth be told. But so these may be subject to change, but there hasn't been much to suggest that they would. We know that the Labour government is still intending to persevere with this bit of legislation. So what are the timescales? So a landlord must investigate and produce a written report of the hazard within 14 days of being notified. Once the written investigation has been submitted, if it's deemed that there is a significant risk to the tenant and repairs are needed, they have 7 days in which to commence the repairs. So very tight timescales, and if once these works are considered necessary, they would have to complete them within a reasonable timescale. Now we are back to that subjective bit to some degree, because we're talking about reasonable timescales. Unfortunately, I don't think that there's much can be done about this as far as clarity, because the cause of dampness could vary so greatly. If it's down to a bit of rainwater penetration where you've got a defective downpipe, replacing that could take a fairly straightforward fix. If you've got water penetration as a result of wind-driven rain on a third-story flat, then obviously the implications of trying to address that are a lot more significant. Emergency repairs, though, must be completed within 24 hours. And if you're a social landlord and you cannot meet those timescales, you will have to provide alternate accommodation if there is significant risk of harm to the tenants. So these are very tight timescales, and if you are a social landlord, you need to ensure that you have systems in place to be able to act on that before the event arises. So if you've got service level agreements with external maintenance companies, you need to make sure that these are, you have the infrastructure in place to be able to meet these timescales. So the second bit of legislation is the Renters' Rights Bill. So this was formerly known as the Renters' Reform Bill, and this essentially gives greater rights and protections to people that rent their homes. This is quite a substantial bit of legislation, and is going to probably cause greater reform in our rental sector than we've seen for quite some while. And there's a lot of changes here. So it's talking about the abolition of fixed-term tenancies, the abolition of no-fault evictions, so they're your 21 eviction, Section 21 evictions, a ban on rental bidding wars, but perhaps most controversially of all, it's going to put give the tenants a right to request to have pets. This is set to affect both existing and new tenancies. I will caveat it, it's had its third reading last week, actually, in the House of Commons. So the next stage is for it to go to the House of Lords. So there is the possibility that there will be some amendments to this. However, there has been nothing to suggest that the bits around damp are actually going to change. So what are those bits around damp? Well, ultimately, the obligations of damp and mould through the Social Housing Regulation Act, so that's essentially our WAB's law, and the timescales that you need to meet, will be extended to private landlords. Now, I have a slight concern around this. If you're a social housing provider and you have an internal maintenance team that can act within quick timescales, that's one thing, and I still think those timescales are quite tight. But if you are a private landlord, you would then get, say, notified of a defect, then you've got to go and find a competent and qualified specialist to go and then investigate that defect. First, you've got to source one of those. Then, assuming that it's determined that works are required, then realistically, good consumer practice would tell you that you should go and get 2 or 3 quotes to go and compare the market, really. At the moment, with these very stringent timescales, I don't think it affords people that opportunity. So I have some reservations there that ultimately, if you do end up in the hands of an unscrupulous contractor, that unfortunately you may have sort of a gun held to your head to get you forced to do works, and that's not what anybody wants. We need to make sure they end up in the hands of the right people. Other aspects of the Renters' Rights Bill that may affect damp includes that all private landlords will need to sign up to an ombudsman as well as a central database as well. So how does that affect damp? Well, essentially, it's going to provide a mediation service for a lot of these people, and someone to hold account private landlords as well. So that'll have an impact. And the other aspect is it will mean that the decent home standard will be rolled out to private homes as well, or private rental homes as well. So currently the decent home standard is a minimum standard for social housing, and that encourages things such as modern facilities and services, a reasonable degree of thermal comfort, and this will now be a minimum requirement for private rentals as well. So currently around 80% of homes meet that standard, private rental homes meet that standard. So essentially there is still 1 in 5 that need to be improved to get there. So a body of work to do there. One last thing on the Renters' Rights Bill, and that is around EPC requirements. So there is an expectation that by 2030, all let properties will reach a EPC rating of C. So that's an increase, I think, from E or D at the moment. So there'll be an uplift. Landlords, unfortunately, will then look for the most cost-effective way of retrofitting their building for insulation to try and improve the energy efficiency of their building. I've already seen a couple of adverts from retrofit installers, particularly spray foam, actually, that promise to get an EPC rating from an E up to a C in a single retrofit measure. Now, on the face of it, the optics might suggest, well, surely improving the energy efficiency of the building is a good thing. But those that are sort of are more familiar with the world of retrofit, particularly when it's done wrong, you get 1 or 2 consequences. Either you don't get the energy savings that you're hoping for, but more typically, and the normal first telltale sign that something isn't quite right, is that you get dampness as an unintended consequence. So my concerns are that whilst this is well-meaning, that if we're not careful and we don't put stringent checks in place with regards to the retrofit aspect, we may end up seeing more properties with damp and mould. The last piece of legislation that I want to make reference to is the Future Homes and Building Standards. So this essentially is an uplift to the building regulations. So this was out for consultation at the start of last year. Now, this is meant to be implemented this year. We don't know exactly when and whether with the change in government, whether that's going to be stalled slightly. But essentially, it is designed to make our home more future-proof and assist us meet our carbon neutral goals. So what this essentially will do will encourage a greater level of air tightness. Now, again, on the face of it, that would seem like a wonderful thing and would be for the benefit of the tenants and those that occupy those buildings. However, my concern would be that ultimately, what this means, if you've got a more airtight building, there is less natural leakage. That means there's less routes for any moisture created in that building to escape as well. That makes you more dependent on your mechanical ventilation system, which isn't necessarily a bad thing. However, our track record when it comes to ventilation and ventilation compliance is not very good. So when we are the more high performance you make a building, you are only as good as your weakest part. And if that's, a ventilation system where there has been a lack of understanding and knowledge when it's been installed or commissioned, then we need to raise the bar there. So much like the EPC ratings, if we're not careful, what we may end up doing is creating more damp problems as a result of well-intentioned policies. So the last thing I want to make reference to, and it won't be the first time you hear it today, or the last. This is the government guidance that was produced back in 2023, understanding and addressing the health risks of damp and mould in the homes. It was revised in the middle of last year under the new government as well. So it's not legislation, but I think it's well worth a mention. And this is aimed at both private and social landlords. And it gives a brief but general overview of types of dampness, the implications of damp, and some of the legislation that might affect damp as well. So some of the key messages on this is it talks about addressing the underlying cause of dampness. Don't just deal with the symptoms. So the scenario that I would sort of suggest or relate to this one would be mold growth. The instinct would be just to go and wipe that mold down and assume you've dealt with the issues, but that's not really the end of it, because you need to address the cause of the what has allowed that mold to grow. So is it down to inadequate heat input? Is it down to inadequate ventilation? Is it down to too much moisture production? So deal with the root cause. What has allowed that moisture or that mold growth to accumulate. So the other thing that it talks about is the need for good working relationships between tenants and landlords. Now, ultimately, the tenant is the one that is in the building. They're the ones that create the moisture in there. They're the ones that operate that building, the ventilation, etc. So I think we need to move away. There's too much of a blame culture at the moment, and I'm not going to go down the lifestyle route. We've covered that in previous webinars, but we need to encourage good working relationships between all parties, because if we work together actually and encourage best practice, particularly for those that occupy those buildings, so there's no point saying, well, they need to use the ventilation system. They need to know how to. They need to be armed with that information. So this is a little bit of a snippet from a document that we did in conjunction with Trustmark. And it's a few do's and don'ts when it comes to controlling moisture in your home. So it talks about becoming familiar with your ventilation system. So what's the type and how does it operate? If it's a rental property, is the tenant provided with that information? Limit the amount of moisture that you're making. So simple tips such as saucepan lids when you're boiling water, cold water in the bath before you put the hot water in, simple things like that. One of the most controversial ones, drying clothes inside. We're often told we shouldn't be drying clothes inside, but the reality is everybody does it. So we need to encourage best practice. If you are going to do it, put your clothes in a wet room, your bathroom, run the extractor fan, make sure it's well ventilated. So some of the don'ts, you don't switch off the extractor fan. Actually they're very cheap to run, and for the benefit you get, it's a bit of a no-brainer. Don't close trickle vents. Now, a lot of these are about condensation and mold, but ventilation won't solve all of your damp problems. So, if in doubt, speak to a professional. Now, the same government guidance, it sort of highlights what a professional should look like, and that sort of things, the relevant qualifications such as CSRT, CSTDB, etc., and the list there. For those that want to find those, you can find people with those qualifications on the PCA website. So, in summary, it's going to be on everybody, all landlords, whether you're social or private, you are going to need to act quickly when it comes to damp and mould. I would say that actually the timescales that are being stipulated means you're going to need to have systems and the infrastructure in place to ensure that you can deal with the issue before the problem arises. You can't be reactionary on this. Be on the front foot. Actually, prevention is better than cure. And a lot of these things can be addressed. So if it's down to inadequate ventilation, this can be addressed before anybody's even in occupation. You can test the flow rates on extractor fans, etc. You can check your maintenance around the building, that sort of stuff. So actually, you can be on the front foot to ensure that you are ahead of the curve when these problems arise. But if in doubt, seek professional guidance. So thank you very much.
Thank you so much, James. That was really interesting. And for those on the line who aren't actively in the sector, I'm sure that was absolutely fascinating and taught us all something new. And now I'd like to welcome Laura Jane. Laura Jane Smith has had a really challenging morning, so please bear with her today. But I'm delighted she's been able to join us. Laura Jane is consultant respiratory physician at King's College Hospital. And she graduated from Cambridge University University in 2006, trained in East Anglia and North East London before being appointed as a consultant in 2019. And as a consultant, her clinical interests include airway disease, integrated care, lung cancer and breathlessness. And she's really motivated by tackling health inequalities and has been part of a project to develop a mental health nurse role embedded into the lung cancer service, as well as a group working to improve nutritional education and a team working to embed prevention in all healthcare interactions. So we are incredibly grateful that Laura Jane has been able to join us this morning, where she's going to share with us some of the evidence of harm seen by GPs and thoracic consultants, and how those health impacts could be treated, and the questions to ask patients who might be presenting with those illnesses. So thank you so much, Laura Jane. Over to you.
Hello, thank you so much. So I'm have had quite a nightmare morning, and so I'm not in my office or at home where I had hoped to be to give this presentation. So I'm hoping that the background noise is not too terrible and you're able to hear me, but please do say if there are any issues. We have got a backup of a video just in case, but hopefully I'm going to start sharing the slides. And hopefully you can see my first slide now. So I'm really excited to be part of this webinar, which I think is a really fantastic partnership between the healthcare sector and the property sector, because if we're going to tackle these problems, we really do need to work together, and we need the expertise of everybody standing alongside those affected to be able to remedy this situation. So I'm a respiratory consultant at King's College Hospital. My specialty is in airways disease, so I see lots of people with asthma and COPD, and it's very common for my patients to talk to me about the difficulties they're having with their housing. And I was actually in clinic yesterday, and 2 of my patients brought up the issue of damp and mould in their houses and how it's affecting their respiratory health. So this is something that's common once we start looking for it. I'm also a member of the British Thoracic Society. I'm a board member there with a particular interest in sustainable healthcare, and that's very relevant to the issue of housing for a number of reasons. James has just alluded to issues around housing and building standards and the importance of energy efficiency, which is hugely important both for the cost of living but also for environmental factors, but the difficulties that might bring if it's not done appropriately with the right knowledge, and that we might actually cause more problems than we solve. I'm also a member of MedAct, which is an advocacy and campaigning organisation which seeks to support and stand with people trying to access their right to good health, which unfortunately is not something that everyone in our communities and our populations is able to do. So I'm going to cover a few things today, and I'm going to come from the point of view of a healthcare worker. The people most likely to come across people suffering from the effects of damp and mould are likely to be GPs, respiratory physicians, and also paediatricians. But I find that many of my colleagues are not sure what to do, not sure what to ask, and certainly feel that they don't want to open a can of worms by asking about damp and mould if they're not able to offer any remedy, which I completely understand. So we're going to go through today what the risks are, what the evidence says, what the role of a healthcare specialist is, and importantly, where we can look for more information, because actually there's lots of very good information presented in a very structured way that's easy to use in a clinical setting. So I'm just going to start with a story from my clinic, which really accelerated my interest in this area, in particular thinking about damp and mould. So I had a patient early last year who I was really struggling with. She had very poorly controlled asthma, very high inflammatory markers for the clinicians in the room. She had a very high FeNO and high eosinophil count. She had a number of emergency presentations to ED and also to the acute medical unit, and we escalated her medication. So she was treated with a combination of high-dose inhaled corticosteroids and bronchodilators. We were adding on secondary medications to try and control things, and she was having a number of rescue packs of both antibiotics but also high-dose steroids. And the fact that she'd had so many rescue packs, particularly the steroid exposure from her primary care team and also from the hospital, meant that she was starting to develop side effects from those. So we were worrying about her bone density, and about her sleep and about other things. Really, sadly, she shared with me in one of these consultations that she was really worried she was going to die when she had these attacks. Feeling breathless is extremely frightening, and it really can't be underestimated just how awful it is to feel that you can't catch your breath. So understandably, this was having a really significant effect on her mental health. Late last year, I saw her again, and actually things were very different. I've seen her a number of times in between, but on this occasion, she had much better controlled asthma. She would describe it as well controlled, which is not something she'd been able to say before. She had normalized inflammatory markers, no emergency presentations for 2 months, and we'd been able to reduce her medication to a lower dose of what she was on before. And of course, the side effects that she was experiencing before were gradually reducing, and her entire outlook had dramatically changed to a focus on living life with a much improved mental health. Now, I'd like to say what changed was that, I came in there as the physician and was the savior and had this magical intervention, but that's not the case at all. And I'm sure from the context of this presentation, you'll know what changed, but we'll come back to her later. So a little bit of information about fungi. Mould are filamentous fungi, so that's the area of animal kingdom that they fit into. And you can see from this phylogenetic tree that in terms of evolution, actually animals, fungi and plants kind of split off at a similar time. So in terms of all life that exists, we're actually relatively close to fungi, closer than you might expect. And fungi are really fascinating. They're a really diverse group of species. There are more than 100,000 identified species, 300 of which at least are pathogenic, cause disease in humans and animals. And they range from really tiny microscopic living organisms, particularly people might be aware of the fungus that infects the brain of an ant and turns them into a zombie. Really up to some of the biggest organisms that we know exist. So some of the largest living organisms on Earth. In particular, there is a species of honey mushroom that covers more than 2,400 acres in Oregon. It's commonly known as humongous fungus, but it does have a more formal name, Armillaria ostoyae. So they're a really diverse group of organisms, and they're something that we come into contact with a lot. So they coexist with us in the environment. You step outside wherever you are and put your hand in some soil, and there'll be fungi in there, and they're doing a good job. The problem we have is when they come into contact with us in terms of provoking our immune system. So I'm talking here about immune responses to fungi in people with normal immune systems. There are some diseases that can occur in terms of invasive fungal disease, which I'm not going to specifically cover today. We're thinking about people who have a normal immune system, but then have symptoms because of the response of the immune system in response to an exposure to fungi. So here you can see some complicated immunological diagrams, but the point really is that we can have an immune response to the mold fragments themselves, their spores, and also mycotoxins, and any of these can cause pathology. The most of the health impacts come from the immune response. So the body recognizes as foreign some aspect of the fungi, and then we have both an innate and adaptive immune response, and a lot of the consequences come from that response itself. There are also mycotoxins produced by some molds, and a number of these have been identified as being pathogenic to humans, and in kind of lab work there's been specific identification of membrane dysfunction, DNA damage, and also cell cycle arrest and apoptosis. So although we're all exposed to fungal disease, we don't all get any disease from it. Most of us will inhale it and never have any problem, but there are people who are particularly sensitized to respond to these that then might be more at risk of health impacts. There are a number of particular species that are very commonly found in the home, and damp surfaces and high levels of humidity, as discussed by James, are some of the reasons that we might find an excess growth of mold in the home, and that they might sort of take seat, and we'll be able to see them. And visible mold is often black mold. That can be one of a number of species, but sometimes it can just be that people can smell the smell of mold and can't necessarily see it if it's not a black mold. these are the most common species, and they'll be familiar to people, particularly things like alternaria. That's a common one that people might be sensitized to when we do allergy testing. If you look in the literature, there's a whole raft of papers looking at correlation between mold exposure and health impacts, but some of them are only really correlation and don't have a strong evidence base for causation. Here on the left, I've got conditions or symptoms that there is strong evidence that are directly related to a number of different molds, either the mold themselves or a mycotoxin. So that's things like itchy and watery eyes, nasal stuffiness, fevers, sensitization to asthma and rhinitis, and then to the development of those conditions, and then flare-ups or exacerbations of those conditions. Tracheobronchitis is just a kind of similar problem, inflammation in the larger airways rather than the smaller airways that we see in asthma. And of course, then things like atopic dermatitis. So there's strong mechanistic and epidemiological evidence for a direct impact of exposure to these molds found in the home and conditions which affect the respiratory system in particular, both upper and lower. The effect of that, particularly when people are exposed chronically, is very significant on people's mental health. It's partly the nature of the symptoms and the fact that they don't get better and the impact that has on people's ability to live their lives normally. But there's a kind of additional layer to the impact on mental health, because we see our homes as safe places where we kind of return from the world, which can be a difficult place. If you've had a bad day, you return home to safety. And so the threat of home not being a safe place and a place that makes you sick is particularly damaging to mental health. And there's also the additional layer of when people seek help, when people say this is not okay, I'm being exposed to these things, and they don't receive any help and they're forced to continue to live in conditions which they know are making them sick. There's that additional layer of feeling like they are not cared for and that society has left them behind and doesn't see them as worthwhile. So the mental health impacts are very significant and important. On the right-hand side here, you can see a number of other listed conditions which there has been suggestion that mold may be implicated, but there is inadequate evidence to make a definite conclusion. That doesn't mean it's not the case, it just means there's inadequate evidence to say for sure one way or another. So further evidence is needed before we could really ascribe mold exposure as a cause of these conditions. You'll see here a list of references that look at both asthma and rhinitis, and you can see that many of them are quite large studies. There are meta-analyses, there's lots of epidemiological evidence. So the evidence for mold exposure and both the development of and then suffering from severe asthma, both in children and adults, is very strong. And you can see here that alternaria is particularly associated, but there are others too. In terms of other conditions, as I say, the evidence is more sparse. And if you're interested in this area, these are some of the references which I think I'd really recommend. So there's a review article here on the pathophysiological aspects of exposure to dampness-associated mold and mycotoxins. And it's a really good description of where the evidence is and where it's strong and where it's not. At the bottom here, separating the wheat from the chaff challenges some of the claims that have been made about the link between mold and some conditions, and is again a really useful and critical review, which is very helpful in kind of pulling out where the evidence is strong and where it's not. Sick building syndrome is something that was talked about a lot for a while, and this is a really useful series from the Lancet on occupational medicine. It's a relatively old paper, but actually it's quite a good description. And the important thing about sick building syndrome is that it's likely to be a combination of factors. Mold has been implicated in some cases, but it's not a definite link. It's a lot to do with building quality and particularly ventilation. So we've already mentioned ventilation as being really essential, and we'll come back to that again, because ventilation really has a big impact on indoor air quality. And indoor air quality is something that people do notice affects how they feel. And then just thinking about the fact that on that list, there were several neurological conditions that were listed. And there is some potential link there with a neuroinflammation, which could be kicked off by exposure to mold. But as I say, that is not a firm link, and I wouldn't want to draw any strong conclusions from that. So there's further work in this area, but we can be very confident from the evidence that already exists that asthma and airways disease and rhinitis are strongly associated with mold exposure. This is just to remind us that there is a gap in the evidence, and so anyone looking for a budding research career, I strongly recommend looking into where the evidence is and where it's not. This image is taken from the Royal College of Physicians report back from 2018, Every Breath We Take, which is a really excellent report, which really was really shone a light on the importance of indoor air quality as a determinant of health. We are quite knowledgeable about outdoor air pollution being really important, and we have quite good knowledge, although not good enough perhaps, on exposure to PM 2.5 and NO2 and other factors in outdoor air pollution and the impact that can have. But there hasn't been as much focus on indoor air quality, and so this is a really useful report. It looks at throughout the life course, so from prenatal, children, adolescents, adults, and the elderly. And this just highlights that humidity, condensation, and poor ventilation are all important factors in determining whether mold occurs. And you can see here that there are a number of different exposures that might be relevant, but that mold is a particular problem in the bathroom, but also other rooms. Is this a significant problem? Should we worry about it? Is it a niche issue? The data tells us this is a really significant and common problem, and potentially increasing. So here there's a meta-analysis that looks at regional and climatic differences of a number of different studies from 31 European countries. And when they took all the evidence together, the estimates for the prevalence of dampness was 12%. 10% for mold, 10% for water damage, and 16.5% for combinations of two or more. So that's really common. And if you're someone who doesn't have damp and mold in your house and you don't know anyone who does, that means that in other populations, it's pretty much everyone. So that's a very high rate of something that we know is problematic. And then even more worrying, in this more recent review of 2020, specifically looking at energy efficient buildings, the real concern here is that actually the rates were even higher, up to 45% in these energy efficient buildings. Now, I am a big fan of energy efficiency. We need to reduce our reliance on fossil fuels, and we need to conserve the energy that we produce. And so energy efficiency is something I would be advocating for. But if it's done in a way that is not appropriate, does not take into consideration all of the needs, particularly ventilation, then we are actually going to cause more problems than we solve. So not only do we need to be mindful about calling for things like retrofitting, it needs to be done with the expertise and with the health of the people living in those buildings really at the core. And so it can't just be a quick fix. We really need to improve building quality and building standards so that we don't cause more problems. This is a significant problem locally. You can see here from this Mouldy Nation report 2023. I've just picked out London, but you can find maps for other areas too, and this is not a London specific issue, but looking at the areas where I work in Lambeth and Southwark, you can see that there are significant numbers of complaints about mould. There are some communities that are much more affected than others, and if we overlaid a map of inequalities of socioeconomic factors, then there would be clear patterns that actually the areas that are most affected by these issues are those who are marginalised and in the lower socioeconomic groups. Shockingly though, 58% of renters in the UK have had mould in their homes at some point in time, and for over half of them, paying for heating was a struggle at the time. So this is affecting more and more people. The cost of living, the cost of energy is a huge issue, and the quality and availability of quality homes is a massive issue, and that's increasingly true for people at higher and higher income levels. The fact that people don't, that renters' rights are pretty limited means that actually this is probably an underestimate of the number of people who should be complaining, because with Section 21 in place, no fault eviction, often people do not make complaints because of the fear of eviction. So it's a big problem that we are not yet addressing adequately. We've mentioned Awa Bashak, and it's really important to understand what happened to him and the evidence that was discussed at the coroner's hearing. So he was 2 years old, living in a one-bedroom flat with his parents in Rochdale. His parents had moved from Sudan in 2016, 2017. and they were living in this one-bedroom flat. Awab died in 2020 due to a respiratory arrest, and this was directly due to prolonged exposure to mould, as stated both on his death certificate and in the coroner's report. It was clear that the home had, and this is a quote from the report, inadequate ventilation and was not equipped for normal day-to-day living activities, which led to excess damp and condensation. And I'm really glad that James brought up the issue of the focus being far too much on the individuals who live in these properties and their supposed lifestyles. These are normal activities. We all need to wash and shower. We all need to cook. We all need to wash and dry our clothes. And our homes need to adequately support those activities. And so normal day-to-day activities should not be a cause of excess damp and mold. The parents did complain. They were not silent. They saw what was happening. They saw the effect on their child, and they complained to Rochdale Housing, first of all, in 2017. And they were told to paint over it, which is a very common response, and is something that my patients talk to me about a lot. Oh, I was told to paint over it, or someone came and they painted over it. That did not remedy the problem. And there were further concerns raised by others, not just by our parents, by health visitors. And a community midwife went as far as completing a special circumstances form in September of July 2020 to highlight to Children's Services the significant risk to this child. So they really, that midwife did the right thing. They raised concerns. And in December 2020, a surveyor described the conditions in his home as unfit for human habitation. These are the kinds of images that were shared as part of the investigation, and these are not uncommon. The degree of, these are clearly not fit for human habitation. There's absolutely no question of that. The terrible state of the level of damp is just horrific, and the visible mold is everywhere. So this is not a subtle problem. I'd really recommend reading this article by Amaran, who is also someone featured in a video that we hopefully will be able to share a section from later, because I think it does a really good job of really thinking about not just the issue at hand, but the causes of that issue and the causes of those causes. So this is really taking a very holistic approach and a broad view of where does health come from and why are people living in poor health. And it looks at housing as, instead of being a place where people build their lives and feel safe, housing is now completely commodified. I had some work done on my house last year, and one of the common conversations I would talk to someone about what I was doing, the fact that we're having a new kitchen or whatever, and they would say, oh, that will really add value to your resale value. And I was just like, this is my home. This is not an asset. I don't care about resale value. I'm creating a home for me to live in and live my life in. And so the kind of the view of housing as an asset is a big problem, and it means that this commodification has led to homes being places of illness and precarity and death, because it's not profitable for people to sort out the issues for the people living there if what they're really looking at is how much they can make, how much they can get out of their assets. And I think it is not overblown to call this a type of violence in which people are forced to live in damp, mouldy, insecure places that make them sick. This is from the Prevention of Future Deaths report. So a coroner can decide that a case they see and they give an outcome on is so important and identifies an issue that needs further work, that they can issue a prevention of further deaths report, and the government then have to respond, or authorities have to respond to what they're going to do to ensure that a similar death does not occur in the future. And you can see here there are some statements made from the outcome from the death certificate that shows that the cause of death was acute airway edema with severe granulomatous tracheobronchitis. So that's an inflammatory and scarring of the airways as a direct response to chronic exposure to mold. And you can see that also, I think, a real lesson for us in healthcare, and this really reminds me of this similar phrasing that was in Ella Kissy-Debra's Prevention of Deaths Award. She was a young girl who died from exposure to outdoor air pollution. She lived around the South Circular in Lewisham. She died from severe asthma that was attributed to her exposure to air pollution. What's said here about Awab's case is also that the medical advice given to his parents was suboptimal and contributed to the fact that his parents were not able to advocate for him. So I think that's a real lesson for us from the coroner. There is guidance from government, which I think it's important we as healthcare professionals know about, because we can use that guidance and highlight that guidance when we're advocating on behalf of our patients who we're trying to make better and who are being made sick by their exposures. So there is useful guidance here. And there are also particular phrases which are quite useful to reflect back to housing associations or landlords or whoever. This is from the Housing Act, I think 2004. There are category 1 and category 2 hazards, and you can see that category 1 hazards, the critical concerns, require immediate action. It includes things like collapsing roofs, which would be obvious, but it does also include severe dampness and mold growth. So this is immediate and severe threat to life and well-being, as recognised in the Housing Act. So we have legislation, we have information that we can use to say this is unacceptable and needs action. So we need to make use of that. So what is the role of the health professional? Well, I think the role is to know the evidence, to ask our patients about environmental exposures, to know how to help patients who are coming to us for help and expect us to be able to give them advice on this. And I do think we have a responsibility to not be complicit in allowing a public health crisis from poor housing and to advocate for change. In my clinic, I particularly listen out for certain phrases which might suggest that someone has an environmental exposure which is relevant to their health condition. So if they say to me, whatever I do, I just feel worse and worse, that's a real red flag. I keep taking more of my medication, but it's not working, or feeling better when I'm on holiday. They're all really key. And then there are some questions I ask if I want to know more. So I might ask, what do you think might be happening? So an open question like that can be really helpful. And then some other specific ones asking about if there's any problem with housing. When we think about asking about if people can warm their homes, heat their homes, I often start by saying many of my patients find it difficult to keep their homes warm enough to stay well. Is that something you've experienced? Because there is unfortunately some shame associated with that. So we need to make it safe for people to disclose issues that they're having and report their concerns. This is a really useful website that was developed by the public health teams in London, which I would strongly recommend you have a look at as a health professional. It takes you through step-by-step actions. So you identify the issue, you assess clinical vulnerability, and then it has information as to how to take action, both you and the patient. And all of my patients are clinically vulnerable because one of the criteria for that on this list is having a chronic respiratory condition. There are also things like older age or other factors like not being able to leave the house because you can't then remove yourself from the exposure. So it's a very easy tool to use. And this is just an example of some of the information that is then shared. So this helps to empower those people that you're seeing. Some of the problem with living in damp and mold is feeling very disempowered. And so giving them the information about what the regulations say and what the guidance is from the NHS and NICE is extremely powerful. And then there are some template letters. So people have done the work for you. You can use these template letters, they use the right kind of terminology, and they help to then advocate. And so as I say, I saw 2 patients just yesterday in my clinic who were really concerned about mold in their homes affecting their breathing, and I wrote them letters that they can then pass on to their housing association, their private landlords, their social workers. And I think it's important for 2 reasons. One is we have a responsibility to raise the issue, and the more we do so, the more there is pressure for change. And secondly, it shows the patient that we understand that this is a real issue for them, that we have heard that they are suffering, and that we care. And so I never think it's a waste of time to write a letter to advocate for somebody. This is just also to show that on that same website, there is also things like visual examples of damp and mold. So you can show people what you're talking about. If there's any, if they're at all unclear as to what might be evidence of damp and mold, you can show them examples. And so it's really helpful. So I think it's important to think about what advocacy is. Previously, we might have thought, or certainly what I've seen is advocacy that's sort of acting on behalf of people or talking for them. And actually, that can have some help, but it's not the most powerful form. We want this to change for all people in society. We want housing to be a place of safety and comfort. And we do that best by standing alongside those also who are affected and asking for change. And that's what we do in campaigns such as MedAct. I am hoping that we might be able to play the first couple of minutes of this video, which was made with healthcare professionals and tenants who were advocating for change in their local housing. Are we able to play the video or not?
Oh, I'm not sure if that's playing or not. I think Carrie's trying.
Okay, we'll give it a go.
We'll give it a go.
If not, we will share the link afterwards, and I'd really, really recommend it. It's quite short. It's only kind of 11 minutes in total, but it's a really great video with some lived experience and voices of people who are affected and who then have worked with healthcare professionals.
All I see is damp. Damp.
Make their issue.
I just wake up
It doesn't
and
look like
I
it's going to
find
play.
the wood dripping like it looks like sweat, or it's like
So
raining
maybe
inside
we
the
will
house.
just not worry, but we will share the link. And as I say, I'd really, really recommend that you do have a look,
Growing up
because it's
in my
a really
community, I
fantastic
saw so
film
much ill
and
health,
brings the
and sadly, I saw
to the fore, and that's who we need. So just to return to my patient in clinic, as I'm sure you've realised by now, what happened in between these consultations was that she was rehoused. So she was living in social housing. It was incredibly poor quality. She was suffering with terrible damp and mould, and everything she did really didn't fix it. She had put into place all of those advice that we've talked about in terms of trying to reduce the amount of condensation, but the housing that she was in was just inadequate. She was rehoused. She'd been on the waiting list for some time, but was rehoused into a much more modern place that was much better, just had better ventilation, just did not have those problems of damp and mould. And you can see the effect on her health. It was absolutely transformative. So she is one of the lucky ones. There are many of my patients who are still waiting for that kind of remedy, and unfortunately, far too many who are being harmed in the meantime. So we have covered a little bit about fungi. I'd really recommend looking more into fungi. They're incredibly fascinating. I'd recommend the book by Melvin Sheldrake. It's a good starting point. We've thought about their health consequences, and particularly the strong evidence for a direct cause of issues like asthma and severe asthma and rhinitis from mould. And we've talked about both the role of the health specialist and where to go for more information. And I'd really recommend MedAct's Homes for Health toolkit, which again has a number of additional resources for everybody.
That's great. Thank you so much, Laura Jane. That was so helpful and interesting, and I learned lots of new stuff today. We have only got a couple of minutes left, so I think we will end up going slightly over time. If you do need to drop off, please do not worry about that. I'm sure you've all enjoyed today's session as much as I have. A few just small comments before we get into the quick Q&A. A few people have noted that the video was working for them, so apologies for that. We will make sure we send that out afterwards, so you all have the opportunity to see it. And of course, we will be sharing this webinar as well. So we will be uploading it to YouTube, and we will be sending that out to both those who attended and those who were unable to attend today. So please look out in your emails after today for the replay. So getting into the questions then, James, a couple of questions have come up for you about data and evidence when it comes to damp and mould. How do we prove, how can we monitor environmental conditions to see what the issue actually is, rather than just making an assumption?
Yeah, okay, so this is Andy's question predominantly that I've seen, is that right? Yeah, absolutely. There's lots of systems out there that will work and help people that are in situ. Switchy have got one which help you regulate or monitor sort of temperatures, RHs and stuff. But That's more of a reactive tool, and that's for those that are in situ. You can do this stuff and preempt a lot of it anyway. You know, the Maple R&D stuff will help you identify what is out of kilter before you even move into the property. So that's kind of the point I was trying to make. Yes, that technology is there. It's readily available for most people. We need to encourage more people to embrace it. So yes, you're clearly aware of it. It's clearly out there. We need to adopt it more and encourage more of it.
Great, thank you, James. And one for you, Laura Jane. And there's some fantastic comments in the chat for you as well, saying how well you did in the difficult conditions you've had this afternoon. So well done. A great question here from Ziodine. If there's no objective evidence of mould, but there was subjective evidence of mould and damp at a house with poor asthma control, what is the contribution of mould in poor asthma control? Is this still significant? They're thinking about this from a medico-legal aspect. So it might be one from both.
Yeah. So, I mean, it's a challenge, you know, we're all exposed to lots of things every day. And in any individual case, the degree to which mould is the cause of their disease will always be very difficult to prove. And I guess there's a difference between understanding exposures and their relevance from how we treat people medically point of view, and then a kind of medico-legal level of proof that
Yeah, I can't hear you, Laura Jane. I'm not sure if you're...
Oh, can you hear me?
Oh,
now?
yes, you're back.
Oh, sorry.
Yes, you're back.
It just dropped off. So what I would say is that, there might be many contributors to something, and we would address all of them. But in many cases, I see, and in what we see reported, that people have done everything. They are on the right medication. They're not smoking. They're fit and active, and yet their asthma, for some reason, is very poorly controlled. And in those cases, we can make a strong argument that there are some ways we might be able to prove a more direct link. So you can do allergy testing, but it is limited. It's not to every mold species. And so it's not definitive. So a negative test does not mean that that's not a contributing factor. But that, as I say, there's a kind of different standard between what we would use clinically as evidence and what might be a medico-legal standard.
Fantastic, thank you. I'm just going to do two last quick questions. We've had one for both of you, really. I think we've got a couple of landlords on the line who are really interested in what tenants can do and what their responsibilities as landlords are. So you talked a bit, James, about it not being the tenant's fault, but we also know that, you know, heating your property can help prevent damp and mould. So I think, again, you touched on it as well, Laura Jane, that there's a political issue at play here, that lots of people can't afford to heat their homes. I'm not necessarily saying there's blame, but in your opinion, what should we be doing more of to help those people so that they can help themselves?
Fine, who wants to go first?
I can go in on that. So I would say that, so there's two aspects to this. There's one, what do you do in that individual circumstance? And then the second is, what do we do more globally to really prevent this being a problem? So in the individual circumstances,
Oh.
We've lost Laura Jane. James, do you want to pick up?
So,
yeah,
absolutely. What can we do to help tenants is kind of the long and short of the question, isn't it? As to how do we... I'll go back to sort of the do's and don'ts that I mentioned on, I think, my second to last slide, really. We are terrible at telling people how to use their property and best practice and things like that. You know, I think we are too often to point the blame rather than sort of try and work together. That you can't just have a ventilation system within a property and expect the tenant to know how to use it, how to operate it. Trickle vents are the prime example of that. You know, that they are there for background ventilation, and you know that's going to give you the vast majority of the air that you breathe and dilute your contaminants and that sort of stuff. So utilising that. There was a reference to the heating thing as well, and that is always the big one, because that's difficult because people can't afford to heat their house, and that's where sort of the changes in legislation are coming in. That's where, you know, the changes to the building regs to make them more airtight, the changes to the EPC grades, so that there are, you know, processes that are coming in that should help the tenant in that regard. So there are steps, just give them time to that regard, but it's difficult because that's the $64 million question, isn't it? Is how do you get them to heat the house if they can't afford to? It's difficult, but hopefully the changes to the building regs and improving ventilation will help things as well.
Thanks, James. I'm conscious that we haven't managed to answer all the questions, but we will try and do so post-webinar, so bear with us whilst we do that for you. In the meantime, a huge thank you to James and to Laura Jane for presenting today, and thank you for all your thanks to them in the comments as well. Before we sign off for today, please do make sure you complete the survey, which will be on screen as soon as you click that you're leaving. We'd love to hear what you thought of today's webinar and how we can improve them going forward. And for those of you who'd like to join us for next month's webinar, our topic next month will be specifically on flooding in the built environment, and a panel debate on how we protect homes and residents. And that will take place on Thursday, the 27th of February. So for now, thank you all for attending, and I hope to see you at our next webinar.